education and entertainment, for health education, religion, politics, entertainment, and many more. Subscribe to Official Elisha TV. You can also follow us on Twitter, Instagram, TikTok, YouTube, and Facebook.
Welcome viewers to Official Elisha TV. Today we are at Living Waters Hospital to have a lecture on hypertension with Dr. Alexander Boye and Dr. Agyemang. Let's get inside to meet them. Welcome to Official Elisha TV. As you all know, we always bring to you good things that are going to improve your lifestyles. Now today, as you can see from the setting, we are here with a great doctor who will introduce himself and where he's working. In case you need his help, that you can even contact him at where he is working now. Now today, before he introduces himself, he's going to discuss a very great topic that's very significant in our lifestyle. That's hypertension. You've almost always been hearing about hypertension. What is meant by hypertension? What are some of the potentials or risk factors that lead us to getting these diseases? So, doctor, welcome to Official Elisha TV.
Thank you very much. I'm grateful to be here.
Thank you. I like your white hair now.
Thank you.
Please maybe introduce yourself too.
I'm Dr. Alexander Boye. I'm a general practitioner at Living Waters Hospital in Sokrapa.
Okay. So he's from what he says working at Living Waters Hospital in Sokrapa in Kumasi. Yeah. Dr. Boye, today we have hypertension on our list. Hypertension. It seems most people are saying there are a lot of myths about this topic. That's why we've come to you to give us the more details about this topic. Hypertension, what does it mean?
When we say hypertension, it means somebody has sustained elevated blood pressure. Sustained elevated blood pressure in the sense that it shouldn't just be one time, like when we just check your BP today, just this very hour and it's high, then we say you have hypertension. It should be sustained. It means when we check it, say 2-3 hours later, it should be high. And before we even diagnose you that you have hypertension, that means you might have had 3 different checks within 3-4 hours apart, or different occasions. Then we can say you have hypertension. There is a cutoff point of diagnosing hypertension. Your blood pressure should be more than 140/90 on different occasions. Then we can say you have hypertension. And in some conditions, like people who are suffering from certain conditions like diabetes and things, we even bring it lower, say 130/80. If your BP is sustainably higher than that, then we say you have hypertension. So basically, that is when we say hypertension, your blood pressure being elevated on different occasions when it is being checked. That's when we say you have hypertension.
Thank you, doctor. While you be saying blood pressure, how? What pressure does the blood uses that needs to increase before?
Okay, any fluid that will move through a vessel or a tube needs certain pressure to be able to go through.
Okay.
And the blood that is pumped by your heart needs some pressure before it could reach the various parts of the body.
Okay.
Right? So the speed within the vessels that the blood is traveling when it is measured. So the sphincter, that is what it is used to measure.
Okay.
When it is measured, it's not supposed to go above certain limits.
Okay.
So when it goes above sustainably 140/90, at some point we even add age, based on your age.
Okay.
Then we will say your blood pressure is elevated.
Okay.
So we have a special device for measuring it, for measuring the pressure at which your blood is being pumped, your heart is pumping the blood through your vessels.
Okay.
Yes, and you normally check it. Now various devices are available. Some we will check here, some of them we are even in a form of wristwatch,
Okay.
based on the device you're using, and it could record the pressure within your vessels.
Okay. All right. Okay. So these vessels, is it those one that you pass cannula in it when you are?
Mostly we deal with arterial pressure.
Okay.
Yes, arterial pressure.
Okay. All right. Thank you, Dr. Boye. So, I've heard and I read about hypertension being. Sorry, viewers. Before you continue, there's a saying in Ashanti that Sankofa Inchi. We have another doctor here that we didn't introduce. Doctor, please. Your name and where you working.
Right, Agyemang Dr. Vincent. I'm currently at Living Waters Hospital, Agyemang.
Okay, thank you, Dr. Agyemang. Before Dr. Boye comes in, I've read about hypertension being referred to as a silent killer. How?
Okay, when we say hypertension being a silent killer, before hypertension will prompt you, or before pressure will prompt you, or your blood vessels will prompt you, you have high elevated pressure. That means it has been there for about, let's say,
a while. Yeah.
Some months,
Okay.
6 months, or but most of the times we actually ignore those signals when our body is prompting us. So by the time you will realize, it will be like you have something called hypertensive urgency.
Okay.
Yeah, that is when you feel like you have headache, dizziness, palpitations, and then all about. So if you didn't pay attention to all these signs and symptoms, you will one day find yourself being like confused or something like that. Yeah, that is when the CNS is involved.
So that's when the signs and symptoms becomes intensified. That's when you can start. Okay.
Yes.
So being silent killer means if you are not aware that you have this problem, it can kill you without getting diagnosed of it.
Yes, please. Yes,
Okay.
please.
Wow.
I just wanted to add a little
Okay.
bit about my brother. He said, like, being silent killer means mostly it won't give you any signs and symptoms.
Okay.
Just like in our setting, I'm just using our setting to cite example. Say Ghana here, when someone is suffering from get malaria infection, so the person might have severe headaches, fever with chills, rigors and all that, right? These are things that when you go to the hospital and start complaining, the doctor might think, okay, you are most likely to be suffering from malaria,
Okay.
right? But hypertension on its own will not give you any signs and symptoms. What it comes with, the English is silent killer is the moment you are having symptoms of it, then it's the complications of the hypertension that is coming.
Okay.
Right? It's the moment people are coming to the hospital, then they are coming with the complications of hypertension. Example, people will come with stroke.
So means if you come with a stroke, then you are lucky.
If you are lucky, and then in the stroke, it depends on the time that you come with.
Okay.
It depends on whether or not you are having a hemorrhagic. The type that means the vessel of the brain is ruptured and you're bleeding into the brain, or ischemic, the one maybe a vessel is blocked.
Okay.
The type depends on the prognosis or the outcome.
Okay.
Right? So it's being silent killer. One, you will come, someone will be there and they will be carried to the hospital that the person is breathless, you can't breathe, you can't even climb a staircase. That means you've had a heart failure from the hypertension.
Okay.
So before the hypertension will manifest in you, then the side effect of it is coming. That's why it's very important for us to be checking our blood pressures.
Wow.
From time to time.
So it's even dangerous than even the hepatitis and the HIV and
Oh no. These are chronic diseases that wouldn't actually definitely might give you some symptoms that you know. HIV, we have HIV and we test you and we know that this is there. Definitely, you put on medications, you're going to be fine. But hypertension, if you are not somebody who is meticulous about checking your BP on time or doing checkups in the hospital, you only end up with, say, kidney failure.
Okay.
Right? The time you're being diagnosed, you have kidney failure. The time you're being diagnosed, you have heart failure. The time you're being diagnosed, you have stroke. The time you're being diagnosed, you have, say, visual impairment.
Okay.
You want to go and see your optometrist, and they will tell you that your BP is high. That is why you are having issues with your eye.
Wow.
You understand? So it comes with the complications.
Okay.
You won't see the signs or the symptoms.
Okay.
That's why it's silent killer. So that's why you said before you will be diagnosed, or before some of these things will come, probably your BP had been sustainably high for some months without you even knowing.
Okay. All right. Thank you, doctor. And so, from what you were saying, you made mention of hemorrhagic or whatsoever. Do we have types of hypertension?
Yes, we have types of hypertension. In fact, we have one that we call primary or essential hypertension.
Okay.
Primary or essential hypertension will be 90 to 90. It will take like 90-95%.
Okay.
Right? And we have secondary hypertension. Secondary hypertension that will have like say 5 to 10%. Right? So the primary hypertension or the essential hypertension means that the patient doesn't have any risk factors of the disease, or there's no underlying cause. Let me put it that way. There's no underlying cause of the condition. Say you are there, you don't have any kidney failure, you don't have mostly kidney failure, you don't have any heart failure or anything, but then you will be diagnosed of hypertension. At the time we are diagnosing you, you don't have any other underlying condition that will give you hypertension.
Okay.
Primary one is the leading,
Okay.
right? Those are the risk factors that we will have. When if we get to the risk factors, we will talk about all those risk factors with the primary. Age is the major risk factor of hypertension,
Okay.
right? People with family histories of the disease,
Okay.
right? And then certain race,
Okay.
like we don't say that we
Relax.
black race, we are more at risk of having hypertension. Then we can even the risk, we have modifiable and non-modifiable. Those that something could be done about, and those that nothing could be done about. You can't change your skin to be white because you're Elisha, we are blacks.
Yeah.
Yes, we are black. So because of that, but our make alone, we are at risk.
Okay.
You can't say tomorrow I want to be 20 again when you are getting closer, right?
Okay.
Age is more than 40, 45. Those are the ages that people are mostly at risk of getting up. You can't say, oh, maybe 45, 50. I want to come down and I want to come to 20 or 25. So my risk of getting hypertension will change, right? You can't take yourself from the family that you are from Mr. Elisha's family, and you want to, because your family has hypertension, you want to come and join Boye's family. You don't have, yes. You can't change your genetic makeup.
Yeah.
How you were made. Those are the non-modifiable risk factors.
Okay.
The modifiable risk factors are those that will probably have certain things based on, say, our lifestyle.
Okay.
You are taking so much alcohol, you are smoking, right? And then you are taking high calorie diet, you are eating late in the night, you are taking more fatty stuff, you are taking more animal protein compared to vegetable protein, and all those things. These are things that, or maybe you are not exercising, you have a sedentary lifestyle, you just sit in your office.
For marriage education and entertainment, for health education, religion, politics, entertainment, and many more, subscribe to Official Elisha TV. You can also follow us on Twitter, Instagram, TikTok, YouTube, and Facebook.
If you have the family history and all those things, if your brother too have you are in the same family with your brother and he's not doing any of these exercises that we are talking about, say if your brother should have the HPT at, say, or the hypertension at, say, age 45, if you are exercising, you are more likely to have it at, say, age 60.
Okay.
Or you are not even going to have it at all because of you are dealing with the risk factors of the disease. So basically this is when. And the secondary hypertension. The secondary hypertension are those that has underlying conditions, like somebody has a kidney failure. If you have a kidney failure, definitely your BP too will be elevated. So you have an underlying condition. You have a condition that has led to the, yes. And then like other type of the secondary to, some people will mention the pregnancy disease hypertensive diseases in pregnancy, like people who get pregnant and get those preeclampsia, eclampsias. These are all secondary. The hypertension is there because of the existing pregnancy. So once the pregnancy is taken care of, the BP will normalize or will stabilize. So these are the difference between the, and we have the other type of hypertension. Some will mention white coat hypertension. Like there are some people when they get to the hospital setting, the mere hospital environment alone, they get kind of, they panic. And so when you measure their blood pressures, it goes high. So those settings, you normally encourage those people that they should do the checks themselves at home. So when they come, those people, you allow them to do the blood pressure checks themselves at home. And then when they come, you see it and see that, okay, maybe in the comfort of their homes, their BPs are fine. Just when they see a big white coats in the hospital, they get kind of scared. Or when they see the BP apparatus in the hospital, they get scared or they get panicked, and their BP go high.
Thank you, Dr. Boye Alexander. Dr. Boye works at Living Waters Hospital in Josokrapa, so in case you need special care, special treatment, at the end of this session, you will just give a contact so that in case you need to know more into this, he is ready to give it to you. Or you can come to Living Waters Hospital at Josokrapa, wherever you are. People are coming all the way from Burkina Faso and outside the country, nearby countries. They are coming here for their health care. So just come around and I know that things will gonna change for you. Dr. Boye, so from all that you were saying, is there any physiology behind this hypertension? Somebody will say, is it your medical terms, is it pathophysiology or whatsoever of this hypertension?
In fact, when we are talking about that's why I said he made mention that it's a silent killer. And then when we say the main cause of hypertension, we say it's idiopathic. Okay. Medically, when we say something is idiopathic, it means it's unknown. Okay. We don't actually know what actually causes. We only can talk of the risk factors. Okay. But what will happen is when the pressure, like I said, within the vessels is increased, that is when we say you have hypertension. So basically, we can't really have a pathophysiology for hypertension because we don't even know how it comes about. We can only talk of the risk factors that bring the hypertension about. So basically, that is it. So if we are able to manage our risk factors that will lead to the hypertension, we will be okay with managing or bringing it down.
Okay. Thank you, Dr. Boye. Dr. Agyemang, it seems you have something to say.
Yeah, my boss has said it all concerning the pathophysiology of hypertension, because I've encountered a lot of people who used to tell me the pathophysiology of hypertension, and I'm like, pathophysiology of hypertension. All what you know is sometimes you may have the central nervous system involved. That is when the pressure will be going, when the pressure is going down, then they will set in to increase the heart rate and then the cardiac contractions. Okay. But to know the exact cause, the pathophysiology of hypertension, just as my boss said, is idiopathic. Yes.
Okay. So then let's come to the incident rate. Which group of people are mostly prone to have this?
Okay, this is more common in men as well. Men have the risk factors of hypertension. Have a higher risk factor, have increased risk of having hypertension. Okay. But when we look at the risk factors of hypertension, like the modifiable causes, we talk of drinking, we talk of smoking, we talk of late eating, we talk of not going to the hospital for checkups and all those things. Men have increased chance of not going to the hospital for any checkup. We have someone who's never stepped in the hospital before. He only goes to the hospital when he is sick. People will just walk to the pharmacy shop and get some over-the-counter medication when they are sick. They will never go to the hospital. Women are actually by nature afraid of death. So when there is small issues with them, they rush to the hospital to find out what is wrong with them. And so women are at higher chances of getting diagnosed of hypertension. But men have increased risk of coming to the hospital with like complications of hypertension.
Okay.
Because they don't come at all. They will never come. I don't even put them on the medications too. The compliance to is poor. So that is it. So men have increased risk of having hypertension.
Okay. Thank you, doctor. So with the age difference, do kids also have hypertension?
The kids, we will put it under secondary hypertension. Before they will have, then there's an underlying cause. Either they have a kidney failure, or which will with nephrotic syndromes and all those things in kids, or they have other conditions. If not, essentially, a child will not have hypertension.
Okay. But do you have some kids that get hypertension?
That's what I'm saying. They are, yes, with underlying conditions. It will be a secondary hypertension.
Okay. So, doctor, thank you, Dr. Boye. May you go for commercial break and we shall be soon right back. Okay.
For marriage education and entertainment, for health education, religion, politics, entertainment, and many more, subscribe to Official Elisha TV. You can also follow us on Twitter, Instagram, TikTok, YouTube, and Facebook.
Yeah, viewers, welcome back to Official Elisha TV. Dr. Boye, we were discussing hypertension, and the one question that we need to be clear of is diagnosing hypertension. Diagnosing. Sometimes when people come to the hospital, we mostly complain that you just give me only one drug, a few drugs, but my bill is huge and those things. And you take my blood sample, you don't tell me what it means. You ask me to go for this photo or whatsoever. How does all these things help you to arrive at diagnosing this hypertension?
But hypertension is not something that is diagnosed by medically, or that we use lab to diagnose. We don't use lab. There's no single isolated test that could be used to diagnose hypertension. But then when you have hypertension, we can use labs and certain investigations to monitor the progress of the disease.
Okay.
Say we need to, hypertension is one major leading cause of kidney failure, right? So we need to check your lab at that time that you are on medication to see whether your kidney function is deteriorating, whether your heart is deteriorating, whether your heart is actually functioning normally. That one, we would have to do some investigations like chest X-ray, ECG. We want to check whether your lipid profile or your cholesterol level is well maintained, because these are the things that when they are not well controlled, it will lead to the complications of the disease, right? So we want to be sure that, one, even before we start you on the medication, your system is functioning optimally, like your kidney function at the time you are being diagnosed. And you need to follow up, like the beginning, maybe 6 months after starting the medication, based on the level that it was found when you were diagnosed. We're going to see the state of your heart. We're going to see the progress of it. All those things are done. Do an ECG to see whether at the time that you are diagnosed, your heart, the hypertension has actually caused some complications to your heart. And these kind of investigations help your doctor or your physician to know the kind of medications to put you on. Let's say you have hypertension with kidney failure. We know the medications that we are supposed to put you on to help the kidney to recover. We have hypertension with heart failure. We have medication to put you on to slow down the progress of the heart failure. We have hypertension with, say, stroke. We have medication that you are supposed to put you on to help you recover. We have hypertension with, say, hypercholesterol or high cholesterol level. There are medications that we have to put you on to help your cholesterol level to like kind of come to normal. So labs are not used to diagnose hypertension, but they are actually used to follow up the progress of the disease and also to help us in choosing medications that are right for managing the condition.
Okay. Thank you, doctor. You've been saying kidney. How does what role does kidney play in controlling hypertension?
In fact, your kidney is like, should I say, it is something that gets rid of most of your toxins from your body, right? Say salt. Let me just come in normal for salt and water balancing. So when your kidney is say not functioning well, it could mean that your body will retain more salt. More salt means more water will move in, and your I don't want to go more physiological. The volume will be there will be, yes, and then your pressure will invariably go high.
Okay.
Right? So like your kidney and even most of your medications that you take are kind of excreted by your kidneys.
Okay.
Right? That's why when you have an issue with your kidney, your BP to go high.
Okay.
And then we have something with as much as possible, I don't want to use medical terminology to so that people will get the understanding well. So your kidney is actually like works hand in hand with the blood. Your blood, everything is kind of filtered by your kidney.
Okay.
And it goes back to the heart for recycling and all this, and then it will come back to the kidney again for all that. So most of the toxins that are within you are supposed to get out of your body through your kidney. Okay. Your liver and your kidney are like they do the dirty work in your body. So if it's not working, your kidney is actually not working. Those things will stay in your body and will cause harm to you.
Thank you, doctor. So if I may ask, if somebody has liver problem, does it also affect? Can it affect the blood pressure?
It could invariably go on to affect your kidneys, which will directly have influence on your.
So the kidney, the liver, the heart has a.
Yes. Yes.
Okay. All right. Thank you, doctor. Dr. Agyemang, can hypertension be cured?
Hypertension.
You've seen before you came, you've seen a lot of people who sell these herbal medications. Some will just put some concoctions and add alcohol in it. When you take it, your BP will normalize. I have cured a lot of people with hypertension and those things. Can it be cured?
Honestly, to cure hypertension, I would say no. Yes, I would say no. It is manageable, but not cured.
Okay.
When those herbal preparations come in to say we can cure your hypertension for you, I quite remember last time when I was going to school, senior high, there was this herbal man in the car. Said, I can give you a herbal drug and all your kidney will, all your hernia will melt and then you get rid of your hernia. I was like, okay, fine, then this drug is really good. But at that time, I didn't know a lot about the medications, or the medicine. So I was like, when I entered into this medical field, then I came to realize that when you say hernia is not something something which has accumulated or come from nowhere into your body for it to be melt out from your body or something like that. But hernia simply means an organ is here, moving from its original position to another place. That is when we say what this is hernia. So it's like so when they play with our mind or something like that. Yeah, these herbal people can say they can cure hypertension for you. But remember, in the beginning you said it is idiopathic.
Sure.
Before you know the genesis, that is when you target the genesis.
Okay.
We don't know the beginning of the disease. How can we cure it? Are you getting it?
Question.
Yes. How can we cure it? We don't know the genesis. How can we cure it? We will always question the judges. Are you getting me? So to cure hypertension, I would say no, but it is manageable. It is manageable.
So does this herbal concoction have some complications on the state of health of these hypertensive patients?
A lot. One, gone are the olden days where Nananom used to pick these herbal things and then it was working.
Okay.
But now we use insecticide spray to spray our farms and then get rid of the weeds out. So the ones coming is not like the previous ones. We don't have actually these herbal people don't have measurement for their drugs.
Okay.
They can tell you can drink full of Voltic a day it will harm you, and then you'll be free of. I was like, you are putting pressure on the kidneys. Remember, you made mention of kidneys being functioning in the part of hypertension.
Sure.
So if you are putting pressure on the kidneys, making the kidneys overwork, even we human, when we overwork, we get tired, and then we can even sleep without knowing.
Yeah.
Very good. So they have a lot of complications in our health system. They don't measure their drug. They can tell you can take any volume you want. How would you know that you are helping yourself or you are not helping yourself?
So who brought this hypertension? Who was first diagnosed? Okay, Dr. Boye,
Yes.
do you have something to add before we go?
I just whether or not the hypertension should be cured. I think he said everything.
Okay.
He said it all, but then it is something that we don't cure.
Okay.
We manage. It's a condition that we manage. There's a swam. When you see, the reason why we say manage is because now there's no approved medicine that okay. Elijah was once a hypertensive patient, but when we gave this medication, it is gone, completely gone. Just like when you get malaria and you come, you know that you take your 3 days course of anti-malaria, you check again and it's negative. It's not like that. It's something that comes to stay with you, will live with you. Once you are alive, it is there. Once your heart is beating, your system is functioning, the pressure to your hypertension too is there. You understand? The risk factors is age. So you are aging. Well, you are still aging. If I'm diagnosed at 45 and I'm 55, is that when the hypertension is going to be cured? When I know that one of the major risk factors is age. You understand? So people just throw dust on people's eyes that they could give you medication to cure. But most of the complications that we are having in our health sector is from these so-called herbal preparations. You know, every drug we take is a poisoning in some calculated dose, right? So if you are going to take 1 bottle of this, even the orthodox medicines that we have, when you take certain limit, it causes harm to you. That's why we have dosages for it. Well, scientifically researched medications have dosages that we give you. So you can just go and take some preparations that you don't even know what is in it. Most herbs, as far as they being medicinal, they could also be toxic. Some of these drugs harm the liver, harm the kidneys. Most of the kidney failures that we have in our house are some of these things that they are taking. The herbal preparations, you talk of they making concoctions with alcohols and things. Alcohol itself, on its isolated, is a major risk factor that could give you kidney failure. And then you add these concoctions with, there are a lot of, now, almost every week there's a new alcoholic beverage on the market. Just, we don't want to mention any brand. There's a new one. People are thinking they want to have higher manpower, they want to be able to be strong and all these things. And now we have lots of young people with kidney failures because of all these things that they are taking in the name of pleasing the woman in bed.
And nature is nature is a cannot please woman. How can woman please woman?
Yeah, so that's definitely what most of them do. So in fact, there's no medication that is there to cure hypertension. You can't cure it. You only manage it in the hospital.
Okay, doctor. Thank you, doctor. So apart from being managed with drugs, is there any other treatment option that could be opted to in order to manage this hypertension?
Okay, so like any conditions that we manage in the hospital setting, we say we have non-pharmacological approach or management. Sometimes, let's say, if you check your BP and it's 140/90, say borderline, and you are somebody who is alcoholic, you are like, you drink heavily, you smoke, you take recreational drugs like cocaine, and you're on all those things, you have a sedentary lifestyle, you don't exercise, you don't do anything. If we identify that your BP is, say, at the borderline, and we talk to you on the risk factors that you find yourself in, and you are able to work on the risk factors, say you exercise, you won't eat at night, you will quit smoking, you cut down or stop your alcohol intake, and all those things. If you're able to bring them down, say if you're somebody who is obese, you're able to bring down your your weight, work on your weight and all that, definitely you might not require medication, but your BP will come down to normal. That is when you are. But at some point, when it's there, and even if you try this non-pharmacological approach and it is not working, it is not controlling your blood pressure, then you need medications to bring it down.
So, for the hypertension to be best managed, you need both the self-management practices and the...
Yes, you need both pharmacological and non-pharmacological. Even if you're on medications and you are still going about with the risk factors, the major risk factors like smoking, drinking, and all those things that we just mentioned,
okay,
your BP control will still not be good. And if it will be controlled, it will need higher doses of medications or multiple medications to manage it. Mind you, I said every drug is a poison and it's calculated doses. And every drug too has a side effect. Let's talk about that. And that is what the herbal people have been scaring people with. Say, you take these medications and very soon at some point you can't even perform in bed and all that. You understand? This is why they've been scaring people. There are medications, in fact, there are very good medications, and the side effects of it are kind of manageable. Before, what is the average age that people will live in Ghana here? What is the life expectancy? 65 years, right? So if you're on medications that you start experiencing side effects after being on for like say 30-40 years, then if you are diagnosed at 40 years, why are you afraid of the side effect of those medications?
You're not worried.
Even if you are not hypertensive, in our setting, you are more likely to die at 60-65 years. So why are you afraid of side effect of medication you are starting taking when you are say 45 years, and the side effect will come after say 30-40 years? And like I said, when we diagnose you, we check your kidneys, your liver, and all those things. Based on what we see, we check on your heart, then we know the best medication to give you. So if we are preview to this information, we are not even going to give you medication that will give you those side effects. And everything, when you're on medication, one thing I want to chip in is when you're on medications and you have any issue at all, any problem at all, you say your better option is going back to your doctor to talk to him. And if he could relate what you are going through with the medications that you're on, definitely there are so many alternatives. You have so many antihypertensive drugs. You could switch you to the ones that will work well for you. If you go to Aponchenchi to eat fufu, it's different. So like you could change the medications for you, the one that will best work for you without complications.
So is it appropriate for those that are living with hypertension to buy drugs outside in case they have headache or they have some funny feeling in their body?
In fact, see, like you just mentioned headaches. People with sometimes when the BP is uncontrollably high, some of the symptoms you might experience is severe headaches. Maybe you'll be having some palpitation. Some people will be having some blurred vision. Some people will be having some dizziness and all that. So if you're hypertensive and you are there and you are just having headaches, if you don't have BP apparatus at home to monitor your BPs, it could be a sign that your BP is getting to the danger zone. So you need your doctor. Self-medication is as much as possible should be prevented. Because you don't even know the condition you are on, the medication that you are going to take, what effect it's going to have on your condition. So as much as possible, we say you shouldn't self-medicate.
Thank you. So I learned, I was discussing with the emergency ward here, that they said most of the patients that are sent into the ward with critical condition, or some of them, you said rotting dead, most of them are those who have defaulted the treatment for hypertension.
Thank you very much. So what happens in our system here is when people are put on medications and they get finished, they don't go for a review. When we were talking, we said hypertension is not something that is cured. Okay. It is managed. It means the moment you are on the medications, you are fine. Your your blood pressure comes down to normal. When you're on medications, it will normalize. So when your medications are finished, it will go back high up. And that is when you get the complications. The hypertension will only give you complications when it is not well controlled. If you have people that the first time they are being diagnosed, they have kidney failure, the first time we ever know that they were even hypertensive at all, they came with stroke. The first time they came with heart failure. You understand? So as much as possible, we advise our patient, we even plead that you don't have to even wait for your medications to get finished before you come. Just when you are about like finishing your last sachet, you come to the hospital for refill. And when you are coming, you come with your medications. You allow your doctor will check your medication for you based on the level that he gets after bandaging you for a while. If he feels your BP levels are going down, so you should reduce the dosages of the medications or the number of drugs that you are on. Your doctor is going to do that. Don't sit in your home and say, I'm tired, I'm okay.
Like I said, I'm cured.
Yes. I don't feel anything, so I feel I'm fine. There's no need to take medication. We said there are no signs and symptoms of hypertension. That's why it's a silent killer.
Doctor, the funny thing is, some pastors are praying for people to be healed of hypertension, but they themselves come for treatment.
That is it. In fact, I don't know whether religion is actually doing us good or bad in our setting, because in the Bible we say everything good comes from the Lord.
Sure.
Wisdom, knowledge, and understanding come from the Lord. Medicine comes from. Before you can practice medicine well, you have to understand nature.
Sure.
You have to understand the creation of God, the creature. You have to understand human being, how your body functions.
Sure.
That's why medicine is somehow difficult to learn. You have to learn how the body behaves normally, so that when it's behaving abnormally, you know, and you know what to do to restore it back. So medicine, we also do believe in God. It's not like we don't believe in God. And then it's God that gives us all this knowledge, all this research, all this knowledge about medicines. They were there. Scientists, we don't manufacture any knowledge. The knowledge is there. We just uncover. We discover. That's why we say, we just discovered that now this and this and this. When you take ABC, you can have this. It has been there. We learn, we research and discover. So I don't think it is appropriate for any religious leader to tell somebody that he's healed a person of certain ailment, or let me just use hypertension, let me teach you hypertension alone. There's nothing that God has given a solution to man that he himself will come down to do miracles on those things. That is my belief. I mean, himself, if God actually has given Dr. Agyemang knowledge to take care of your hernia, when you have hernia, he will not give healing power to Pastor Elisha to pray for hernia to be healed, when the knowledge is already given to Dr. Agyemang to operate on you for your hernia to go away. So I think that is a waste of time, and then they should stop. We advise that they stop those things they are doing, because most people who, in the name of their pastor says, their religious leader says, and they stop their medications that they are taking, comes with complications. And at the end of the day, people stop their medication, go stay with prayer centers. A lot of you drink concussions.
When the seems 40 days fasting for our colleagues Muslims, I learned some people were rushed to hospitals because they were fasting, so they stopped taking their medications. Some of them were peptic disease patients, some were hypertensive, some were diabetes.
I'm not cutting you. Last year, when they were embarking on the Ramadan fasting, we had like 3 people with gastric perforations.
Wow. And
gastric perforation, if you don't get good surgeon on time to operate on you, you will die. Because they were fasting. The Quran doesn't tell anybody that when you are sick, fast. There are exceptions. There are clear exceptions that when you are sick, when you are embarking on a journey, or you are traveling, when you are pregnant, when you are breastfeeding, and all that, you are exempted from the fasting. People who are aged, children, are exempted. So when clearly you are sick and you have, say, gastritis, gastric ulcer, and you are supposed to, you are not supposed, one of the things that will exacerbate or worsen your condition is fasting, and you go and fast. This one is not like, I don't think God will say because you are fasting you can't suffer from the complete. You know clearly that when you do this is what is going to happen. You understand? You know clearly that you have hypertension, you are supposed to be on medication. If you don't take your medication, you have stroke, you have kidney failure, you have this. So these are the things that in fact we want to get platforms like this to educate people, so that, especially the churches, so that the pastors, they wouldn't play God and they just allow their members to be on the medications when they are supposed to. Fasting is not the only way that you could pray to God. Fasting, I think, in my own understanding, just helps you to concentrate. And you concentrate, don't just sit in class and concentrate with our belly full. Yes, you can do that. So I think we can.
Thank you.
I want to say something small.
Okay.
What God has given to man to do on earth, God will not come down and do for man again.
Sure.
Simple.
Are you getting
That's why even after creation, he said, multiply.
Very good.
Reproduce and multiply.
Very good. Very. Me, I am in ministry, but when you come, I won't tell you I can pray for you for your hernia or your hypertension to go. I will tell you go to hospital, because God has given knowledge to man to do this. God won't come down again to do what He has given to man to do it.
The problems of God has more problems than even man. All this about millions of people in the world, everybody is praying, everybody is mentioning God. What do you think? God even faster.
It's something.
Okay, so Dr. Agyemang, last but one question. On this note, when regards to review of client care, what do you have to tell our patient? What do patient need to expect during review, and why review?
The patient presented with the complaints initially. He was taken care of by the doctor. He was given some medications to be taken, right? Yeah. It is the aim of the doctor to see all these symptoms resolving, okay? And the medications given is not a magical medications,
okay,
to just let the symptoms vanish just once.
Okay.
It takes time. So for the review preparation, it is actually for you to know the drugs which were given or the treatment which were given to you are well, your body is tolerating with those medications and then the treatment. If not, if there is a need for the doctor to go further with another dosage or another medication, then the doctor will do so right after the review. But most of the times in our settings, especially the Africans, we don't like coming for review at all. Especially when someone comes with malaria and then the person gets rid of his or her symptoms and they ask the person to come back again in a week time for review. When the person gets to the house and knows everything is fine, he will never step here again. Are you getting it? But that is really wrong. Yes. Review is meant for the doctor to see if what he planned for you, the treatment he planned for you, is well with you, or there is another symptoms popping up even in as much as taking the medications given.
Okay. So it's like evaluation phase.
Very good.
Okay.
Of which patient needs to be prepared and then be happy to see the doctor next time. To tell the doctor, oh doctor, the medications you gave me last time is working for me. Oh, I went to, I was doing this, I was doing that. Especially we are talking about hypertension right now. When you are newly diagnosed hypertensive clients, you have to come for me. I'll ask you to come for review in 2 weeks time. Then I'll give you a BP profile to check it in your house for me.
Okay.
When coming for the review, I have to know how you are tolerating with the medications, because the medications of hypertension differ, and then you have classes of hypertensive drugs given to certain kind of people. My boss already explained, we have, when you are having a heart failure, you know the medication given to you, and even we don't go with a high dose, we go with what, the minimal dose first, and then before we climb the ladder. So you have to know if those doses given to you are working for you or not. But Africans, we don't like coming for review.
Thank you, Dr. Agyemang. Dr. Boye,
Yes.
are you going to add something?
Yeah, in fact, review, like he said, he said like in actually everything. Review will make your doctor reassess you to know the condition whether you are improving, whether you are deteriorating. That is how we assess. Because you come with headache, I give you medication. When you are in your house, I wouldn't know whether your headache is resolved. Even the medications we give you, it may have certain side effects. And not with any individual. It might not be same with every individual. But when I give you the drug and I see you again, probably the moment I see you, I can pick some of the possible side effects on the medications that I gave you. Then I will know that, oh, this medication will not help you. I need to switch it. When you come and we do reassessment, we will know whether or not to continue with the same dosage of medication you are giving, whether to step up, whether to even add up different medication, whether to hold it or even change it in at all. So reviews are very, very, very necessary. And then people, when we talk about review, I also want to add there are people who are fond of doctor shopping. When we say doctor shopping in medicine, like today you go and see Dr. Agyemang, tomorrow you go and see Dr. Elisha, the next day you go and see Dr. The next day you see a different doctor. Every doctor you go, based on the assessment you do, his own assessment will think of certain medications to give you. So at the end of the day, the person have like 5 different medications.
And they are taking more.
And the side effects of it. So with regard to chronic diseases, it's not always so to do doctor shopping. Like you go to, say, you are closer to, you go to hospital A, tomorrow you go to hospital B, the next day you are with facility C, the next moment you are with facility D. When you do that, you actually disturb yourself. There's something we call continuity of care. If I started with you, say you have heart failure, and at first you could not walk from here to the roadside, and now when you came, you could walk. I know whether or not I should maintain the medications you're on. I know whether or not I should step up. But when you go, the person who is going to see you initially don't know the state you are in. Right? So we can just look at it and say, maybe you don't need this medication, you don't need that medication, so let's take it out. And just take it out. And the moment the person takes you out those medications, complications, this time when they are coming, they don't come even as how you started, they come with higher, worse complications. So doctor shopping with regards to review is also very necessary. Patient should, or client should take care of that. It's better a doctor who knows your condition, knows how you started. If the person himself thinks where you've reached is beyond the scope of his practice or is beyond his strength, he would gladly refer you to a different physician or a different doctor with a note. Okay. You will tell the doctor how your sickness started, where he is now, what he has done so far, so that the person can, based on that, continue for you.
Thank you, Dr. Boye. So on this note, is review date, should patient always come for review as scheduled, or in case the review date is not yet due, but the person don't feel well or don't feel okay, should the person need to come?
Review days are given for patients to come back to see their doctor.
Sure.
One, based on, that is when all things are equal.
Okay.
I can start you on medication today, and when you go home, things will get worse on the medication that you are taking. Okay. You don't have to stay home till the review date. Okay. The medications that we gave you are supposed to make you better, not to make you worse. Okay. So when you go home and things are not working as planned, I normally talk to my patients that you don't have to allow yourself to be carried to the hospital. Like we still, like typically what you've been seeing in the emergency, somebody is a hypertensive, he can't breathe. The patient starts with say dyspnea or difficulty in breathing on mild exertion or walking small or maybe just climbing the stairs. This is how it might start. The person will overlook it. He will be there until the middle of the night when he is not able to breathe at all. Then
some will even come, they will be dead but breathing. The brain is dead but they are breathing.
You understand? So this one is no good. When the moment things go abnormal, like things don't go as planned with you, definitely your doctor will tell you that, oh, this drug I'm going to give you, your symptoms are supposed to be better within maybe 48, 72 hours. If the things are not better, then you have to come back to the doctor. You don't have to wait for the review date.
Well, thank you, our doctors. Still, we are still at Living Waters Hospital. If you wanna feel what Dr. Boye and Dr. Agyemang can do, just come to Living Waters Hospital at Ejusu Krapa. That's where they are based. You will just meet them and you'll love the scene. Okay, our last discussion is on let's prevent hypertension. What do we need to do to prevent hypertension?
Like you said, we have modifiable risk factors and non-modifiable risk factors.
Okay.
With prevention, we can only deal with the modifiable one. Right? The non-modifiable, like being a black race, age, and all that, we can't change it. With our family history of hypertension, we can't do anything about it.
Okay.
Right? But the modifiable ones, like say if you are obese, right? Obesity could predispose you to getting hypertension.
Okay.
Right? If say you are a chain smoker, you are a smoker, cigarette smoking is number one risk factor for hypertension.
Okay.
If you consume alcohol too much, drinking alcohol too much is a risk factor for hypertension. Right? If you are somebody with sedentary lifestyle, when you mention sedentary lifestyle, somebody we just sit down, maybe like I'm working in the consulting room, I come sit under the air conditioning, I eat my breakfast before I come, sit in my car, drive in, come and sit in the air conditioning. When I close, I get into my car, go home, eat and sleep. You understand? Your body actually, you need to exercise. So these ones, if you know that exercise is supposed to be part of your thing. They say there's a saying, then you're tight. You're tight. You have to know that you have to cut down the sodium food, fatty or high cholesterol stuff. Like sodium, like reduce your salt intake, reduce your spices intake. As much as possible, reduce your canned stuff intake. All those things are the things that will predispose you. They say if you don't let your food become your medicine, medicine will become your food. That is very big. That is a very huge thing. It means our life should be tailored towards making our health better. Anything that you're taking, your body is going to account for it. Anything that you're taking, if not now, later you account for it. So, you understand? So we must plan of having healthy diet. You understand? Our diet and everything, our lifestyle should be healthy so that all these things could be taken care of. So those are the only things you could do to kind of prevent or even slow down or increase the age that at which you get to say all your family members are getting it at 45 years. Then if you are taking care of yourself well, taking care of the risk factors of disease well, maybe you might even be 60 before it comes, which is a plus for you.
Thank you, Dr. Boye Alexander. Dr. Agyemang, your last word, how we prevent hypertension?
My boss has already said it all. Yeah. So, more especially, let me target the smoking ones and then the alcoholic men and women. You know, these people, we've already discussed about the consequences in this hypertension issue. Yeah, if they're able to get rid of their personal lifestyle, then, well, it will be a plus for them, just as my boss said. It will be a plus for them. Yeah.
Thank you, my doctors, and for this wonderful presentation to our viewers. I know that those who are watching this video will do well to come for your services at Living Waters Ejusu Krapa. You can find Living Waters at Ejusu. When you get to Ejusu, you will just ask for Krapa or Living Waters Hospital. It's just by the roadside. You just go there, and in fact, all the nurses and midwives and the doctors, all the paramedics, they are all friendly. You love the atmosphere, you love the working condition, the environment, everything that they do. When you enter the ward, in fact, you feel it. The ward itself is organized in such a way to help you alleviate your pain and restore your health early for you. So just come to Living Waters Hospital at Ejusu Krapa and know you meet Dr. Boye, you meet Dr. Agyemang, Dr. Obobi aka Koso, all the doctors here, you meet them and you love it.